Hello guys, and welcome to this webinar, 5 must-know strategies to successfully rehab a shoulder injury. And today we're here, Alex Blazewski and Sean Lawyer. We're going to share some very important information with you about your shoulder injury, how to look after it, how to make sure that you finally come to a resolution and get rid of it. Now we're having a few people joining us as we speak, so we're going to give it another minute before we get started. Okay, so in the meantime, feel free to type in your name in the chat box just to let us know that you're here. Also, let us know if you can hear and see us as well. All right, we might as well get started. So first of all, who is this webinar for? Who is going to benefit the most out of the information that we're just about to share with you over the next 45 minutes? So obviously, if you've suffered from a shoulder injury recently or possibly in the past, but it still hasn't fully recovered, you sort of feel like you're still suffering from a residual weakness in that shoulder. If you're suffering from a weak shoulder, so that means not necessarily something that's hurting, but it sort of doesn't feel 100% right, that keeps troubling you over and over again. If you exercise regularly, and it's important for you to stay injury free, we're also going to share with you a few important ideas. If you want to stop shoulder injuries in the future, so maybe you had a bad experience in the past, you might have suffered a bad injury, you've recovered, but you sort of want to stop this coming back in the future, you also will find some useful tips in our presentation. So I'm just going to quickly sort of introduce ourselves. So first of all, Alex, I've been a physio for close to actually just over 16 years. So I've graduated as a physiotherapist from AUT in Auckland back in 2004. I also hold a postgraduate diploma in sports medicine from the University of Otago. Now, just to let you know, I'm not a doctor, so it's just a postgraduate diploma for physiotherapists. I started Bodyfield Physiotherapy Clinic in Howick back in 2010, and I have literally seen hundreds, maybe even over 1,000 of people with shoulder problems and help them recover over the years. I've also helped to co-author a book called How to Feel and Look Younger Naturally. Now, a little bit about Sean. Now, I'm actually going to talk about Sean a little bit. He's having a bit of an issue with his microphone. He basically, we worked side by side for the last probably 3.5 years. He graduated as a physio also from AUT back in 2017. He's got a certificate in orthopedic manual therapy. There's a course it's a postgraduate course he's done, so he's pretty clued up on shoulder injuries. And yeah, like I said, we've been working together since 2017. Now, one important thing I'd like to note before we move on any further. This webinar is not a substitute for proper physiotherapy or medical treatment, and you should always be assessed by a fully qualified health practitioner. So what I want to say is, I don't want you to watch this webinar today and kind of say, oh, that's all I need. I'm just going to take this information and I'm going to do some self self-care or self-treatment. Okay, you still do need to go and see a health professional if you have a serious shoulder injury. And the advice that we're giving, we're actually not giving personalized advice. So whatever advice we're giving today, it may not be suitable for your particular situations. Just be aware of that. So first of all, I want to cover off on why is it that shoulders are so prone to injury. There's actually a number of reasons. As you're probably aware, shoulders and backs are kind of the two most common injuries sort of among people. And the main reason is that the shoulder joint is very much it's a very mobile, very loose joint. In fact, you could pretty much say that it's the most mobile joint in the body. Okay, and the reason for that is that as humans, we actually need quite a big range of movement in our shoulder joint. If you think about it, like you can actually lift your arm up right above your head, you can twist it behind your back, you can reach behind your back, up and down, side to side, turn it, twist it in and out. So if you compare the shoulder joint, say, to a hip, you actually realize that there's quite a big difference. The hip joint cannot move in so many different directions. It cannot actually move all the way up, all the way down, twist side to side. Now, that mobility comes at a cost, okay? And the cost is the stability of the shoulder joint. It is quite an unstable joint that's actually quite prone to injury and dislocations. So shoulder joint is probably one of the most common joints to be dislocated. So it's actually, if you look at the pictures here on the left-hand side, you'll see that it's a ball and socket joint, and the cup or the socket of the joint is actually quite shallow, as opposed to a hip where the socket of the joint is actually quite deep, and the head of the joint sits nicely in a deep socket of the hip joint. So it's very unlikely to dislocate, whereas the shoulder joint is a completely different story. Now, shoulder joint is reliant on a number of muscles that sort of wrap around the shoulder joint called rotator cuff muscles. They help to keep the ball in the socket. Okay, so that's pretty much the main reason why shoulder is very prone to injury. So as I sort of alluded before, there's a number of structures that attach to the shoulder. So the shoulder joint is not only the most mobile joint in the body, it's also potentially the most complex joint in the body. If you can look at those pictures, you can actually realize that there's a number of different muscles that attach all around that shoulder girdle to a certain degree to keep it stable. Okay, so you've got rotator cuff muscles, you've got bicep tendon there, so a number of structures there that make the shoulder joint very complex. So what led us to actually put this webinar together? So we believe that we have a lot important information to share with you, because between the two of us, we actually have about 20 years of experience combined in working in private practice. We've treated hundreds, possibly even over 1,000 of people with shoulder injuries over the years. We're seeing shoulder injuries over and over again that can be completely prevented if the person just knew what to do, what exercise, what rehab to do in order to stop these injuries reoccurring. And so we want to share information with you today on how to stop these injuries coming back again and again. We've observed a huge variance or the huge difference between people who stick to their rehab plan and those who don't. Okay, so we want to emphasize the importance of doing the right exercises for your shoulder recovery, because it does make a difference. There's absolutely no doubt, if you do the right exercises, it makes you recover a lot quicker. So Sean is going to join us today, and you're going to hear his voice in a minute. He's going to talk about the different types of shoulder injuries. So he's going to start with rotator cuff. So Sean, welcome, and fire away.
Thank you very much, Alex. Hi, everyone. My name is Sean. I'm one of the physios that works with Alex. I'm also one of the physios that works with Elaine and Nick. So I'll be going over the different sort of shoulder injuries that one can come across. And as Alex has mentioned before, we have seen a lot of these throughout our years of experience. And the most common one is what you see in front of you, the rotator cuff. Rotator cuff consists of 4 muscles. They're easily acronymed in the word of SITS. So S stands for supraspinatus, I for infraspinatus, T for teres minor, and also the subscapularis. So if you have a look at the picture here, this is the person facing us. This is the front of the shoulder. This muscle here, where they say the subscapularis muscle, sits just inside the shoulder blade itself. Behind it, or even as you can see up here, is the supraspinatus tendon. And then we also have the infraspinatus tendon sitting just in the back over there. So the subscapularis, its main function is to rotate the arm inwards. The supraspinatus, its main function is to bring the arm out to the side. And the infraspinatus' main function is to rotate the arm outwards. The teres minor also helps with that sort of function of also rotating the arm outwards as well. As mentioned before, it is a very common injury. We see this very often, and it affects all sorts of different age groups. So it can affect very young to also very old people as well. We'd see it in young athletic populations if they do a lot of baseball throwing or any sort of throwing activities, and especially in the older population if they tend to lift anything heavy or even fall on it. As mentioned before, it can be caused by even a bad fall as well. It does take quite a bit of time to recover from, but you will usually see some improvement in some way, shape, or form. Usually ACC allows you to have about 4 to 6 weeks worth of rehab before then we as physios would say we need to get some sort of scanning done to it. Depending on the severity, as one of the bullet points mentioned, it might be an immediate referral to a specialist, or it may just need a little bit more time. It really just depends on how intense the tear is in any of those muscles itself. Moving right along to bursitis. Now, bursitis can also be classified in the main umbrella term of subacromial impingement. So if we look at subacromial impingement as a big umbrella term, one of the spokes of it, or one of the little pointers, would be bursitis. Another one could be even tendon thickening. Another one could even be just a joint swelling or any sort of effusion. But bursitis is something that we also see fairly often. It often triggers when pain is lifting up the arm, so especially out to the side or even to the front. Now, again, this depends on where the bursitis sits and how swollen it is as well. Just to give you a bit of understanding, bursitis is like a fluid-filled sac that sits just here in the acromion, as well as between the tendon itself. It basically prevents the tendon from shredding against the bone above it. Think of it as a moving lubricant itself. It can actually exist in people who are pain-free. So there have actually been studies to show that people can actually have an inflamed or swollen bursitis and still be asymptomatic. So many times these sorts of conditions can be seen on ultrasound, but may not be the actual problem. So what happens with the bursitis is that it can usually occur when there is a sudden impact to it. So something like what we call an axial force coming from down upwards, or even a direct force coming from outwards to inwards like that, can cause the bursa to inflame and cause a little bit of restriction in movement. Think of it simply as putting a spanner into the works, or even a spanner in the cogs. That's basically what a swollen bursitis will do to your arm. It just restricts your movement, but doesn't necessarily mean there's any additional damage. The best way to really pick up on this, or easiest way to really see that there is a bursitis, is using an ultrasound scan. Now, again, depending on how intense the swelling is, it may require cortisone injection by a specialist, or it may just need a bit more conservative treatment and a bit more time to get better. Moving right along, we come to shoulder dislocations. Now, this one can be classified into 2 categories. The first one is what we call a traumatic unilateral with a Bankart syndrome. So I'll come back to that Bankart in a moment. And the other one is an atraumatic multidirectional instability. I have experienced both myself, so I can speak with experience that both are quite annoying. When it comes to the traumatic one, it usually involves the hand in an abducted or external rotation. So that means basically if you put your arm out to the side and then bend your elbow to 90 degrees and try and push it backwards, that is what we call an abducted and externally rotated. This means that the shoulder joint has the least amount of congruence or contact with the glenoid. So if you look at this picture here, we can see that the actual ball of the ball and socket joint has actually come away from it, and this is a posterior dislocation. What can also happen is that even if you were to bring a hand out to the side or abduct it and internally rotate it, you can also dislocate your shoulder that way. The other form of shoulder dislocation is what we would say as an atraumatic multidirectional. So this means that the surrounding muscles in the areas don't necessarily have the right sort of neural contraction or even muscle strength to keep that ball and socket in the correct position or intensity. Okay. For this one, usually for a traumatic one, an X-ray is required, and that's where we would see a sort of a Bankart syndrome where a part of the bone has actually chipped away. If it happens more than 3 times, a surgical intervention is required. So this is what we can see in terms of a very intense shoulder dislocation, and this is what we call an inferior dislocation. So that means it's come down. Next one is a frozen shoulder. This is where you get a constant pain and a great difficulty moving the affected arm. It mostly affects women and mostly between the ages of 40 to 60 years old, usually those who are in the postmenopausal age. Sometimes it is preceded by a minor injury, but sometimes it can also occur just gradually over time. This condition takes a lot of time to recover from. And as you can see from the time frame, 12 to 24 months. I would say based on some of the experience I've had, the smallest or the least amount of time I've ever come across for the frozen shoulder is 6 months, but that would be more of an anomaly rather than the rule itself. So this condition does take quite a bit of time. And unfortunately, there's no real scan unless you do a CT or MRI scan that can actually prove that you do have a frozen shoulder.
All right, cool. So guys, now look, this is the meaty part of today's presentation. So we're going to talk about the 5 strategies for successful shoulder rehab. Now, let me just emphasize something. We don't know what kind of injury you have. We don't know whether you have bursitis, rotator cuff injury, or whatever else. So therefore, don't take this this information as a personalized advice. This information we're sharing with you today is a general information that covers pretty much all shoulder injuries. So the 5 things that are very important for shoulder rehab are as follows. Get a diagnosis. Okay, so this is, I mean, it sounds very obvious, but a lot of people, they get a shoulder injury, they stay at home, they go to YouTube, they try and basically Google what the symptoms, they find probably the worst case scenario, and then they kind of dwell on it, or they do nothing at all. Okay, so look, it's pretty much the first thing you do. You have to know what's wrong with you. So seeing a medical practitioner or a physiotherapist is a must. Okay. Then once you know what's wrong with your shoulder, then you can actually make a plan. The second one is getting the arm moving early. The third one, address the muscle imbalances, deficiencies around the shoulder girdle and the shoulder blade. Number 4, progressive gradual strengthening. And number 5, adjust your daily in work activity. So we're going to go through them all in a bit more detail. So strategy number one, get a diagnosis from a registered health professional. Very, very important. So the reason why it's also important is because whether you do something, whether you have the right treatment right now or not, can actually affect you long term. There's been a number of studies done, and particularly on rotator cuff injuries. And what they actually found is if you don't do the right treatment right now, your injury can actually get worse over a period of time. So a study was done about 10 years ago, and what it actually showed is that after 2 or 3 years, 49, roughly half of bad full thickness rotator cuff tears actually increased in size. So that means if you do nothing at all, the injury can actually get worse. And another study was done, and what they actually found was that 40% of the partial thickness, so that's kind of a milder version of a rotator cuff tear, left untreated had progressed to a full thickness tear. So it was a mild tear, and it became a bad tear after a period of 2 years of doing nothing. Okay, so whether you have a rotator cuff tear or not, we don't know, but it's important to find out. Okay, so that's why we encourage you to do seek a professional advice. Another reason why you want to get professional sort of advice, medical advice, is sometimes you can get something really nasty, like a fracture. Okay, they're less common, but they can happen. Now, you definitely don't want to miss one of those, because if you do have it, it's extremely important that you get treatment right away. Now, strategy number 2, get the arm moving early. A lot of people, when they're injured, they think, okay, I've just got to stand on the couch. You pretty much need to stay still and not move, okay, because somehow the injury is going to get better. Well, it's actually, in most cases, this is not true. Now, some injuries, such as fractures, like, if you've broken a bone, or serious AC joint injuries, require you to stay still and rest your arm in a sling. Now, that is absolutely true. That's why we say you need to get a diagnosis first. But many other injuries, moving your arm early is going to help you recover faster and regain the range of motion and mobility. Okay, so for many shoulder injuries, you're actually better off starting to move your arm nice and early. So keeping your arm immobilized in a sling or any other sort of way for long periods of time can be detrimental and may actually slow down your recovery times. Conditions that often do better when continuing to move the arm include mild rotator cuff injuries, frozen shoulder, and post-operative rehab as well. Okay, so always stick to your health professional's advice, but a lot of these injuries will actually benefit from you stretching and moving your arm. So this all highlights the importance of proper diagnosis by a health professional. Strategy number 3, we're going through them really fast. You must address the muscle imbalances and deficiencies around the shoulder girdle. Okay, I'm going to explain a little bit in a little bit more detail what that actually means. So this is basically a view of your shoulder from the front on the left-hand side and from the back on the right-hand side. And you can see that there's a lot of things that are sort of attached to around the shoulder area. Okay, you've got the bicep tendon, you've got chest muscles, you've got rotator cuff, deltoid, trapezius muscles. Now, if you look at this area on the right hand side, so this is the shoulder blade. Part of the shoulder blade is right now it's covered with muscles. Okay, now your arm is attached to the shoulder blade. Okay, so the shoulder blade actually forms the socket of the shoulder joint. Now, if the shoulder blade is not positioned correctly, the whole arm cannot move properly. Okay, so the muscles that control the position of the shoulder blade are extremely important. So some of the muscles that control the shoulder blade include serratus anterior, rhomboids, and trapezius muscles. Now, you don't have to remember those names, okay? That's not important. The important part is that you can't just rehab the arm or the shoulder joint. You need to take into account the whole shoulder girdle. And when you see your health professional, your physiotherapist, they must involve rehab of the shoulder girdle because otherwise the rehab may not be effective. Now, when we compare the importance of the shoulder blades for the rehab of the shoulder injury, I like to think of a foundation of a building. Okay, so because your arm attaches to the shoulder blade, you can think of your arm as a house and the scapula or the shoulder blade as a foundation. Okay, now if you build a house and you build it on a foundation that's sort of weak and on a bit of a funny angle, I mean the whole house is likely to collapse. Okay, and for exactly the same reason, it's very important to strengthen and address the deficiencies in your shoulder blade area before you start to actually address the shoulder injury itself. Hopefully that analogy makes sense. So this is a good example, this picture here, a good example of what we call scapular or shoulder blade winging. You can see that the shoulder blade actually comes off the chest wall in this individual on the right hand side. So that clearly demonstrates that some of the shoulder blade muscles are weak and they need to be rehabbed, they need to be strengthened before you actually go ahead and start treating the actual shoulder injury itself. All right, so yep, shoulder blade weakness needs to be addressed first. All right, and Sean is going to take over from strategy number 4.
Thanks, Alex. So strategy number 4 is progressive gradual strengthening. So to put it simply, if I were to tell you to go to the gym and try and lift up the heaviest weights you can find, you can see that you'll get injured quite easily. So what we do is we slowly build up the strength or build the foundation of strength and then gradually get into it. So what we have here are three sort of common exercises that we give to build that foundation. We've got the shoulder external rotation, which is all the way on the left here. In the middle is the internal rotation, and on the way on the right here is the abduction. So this builds up the strength in the shoulder blade and also the rotator cuff muscles, which are also very important as well. Some of the other exercises include rhomboid activation, lower trap activation, where you'd usually be lying on the floor and lifting your shoulder blades and your arms up. And of course, not to forget pec major and also biceps as well. All of them play a very important role in keeping the shoulder nice and healthy. The fifth strategy is adjusting your daily living and also your work activities. Very simple. For example, if you're at work and you're getting a lot of shoulder pains, then it's something at work that's bringing it on. And most of the time it's just down to posture and even the workplace ergonomics itself. Okay. So for example, let's say looking at the picture all the way on the right here, this person is lifting a fairly heavy couch with a bent back. So that means a lot of pressure is going to go through the arm and back itself. So pretty much a high risk for any sort of shoulder injury. And for example, if this person was a chef or even working in a cafe, multiple times of reaching upwards and picking items off the shelf, even if they're somewhat heavy, can put a fair bit of impact on the shoulder and even the shoulder blade complex itself. So try and avoid these activities and try and keep your shoulder blade and even your arm in a sort of a ideal ergonomic setting where you sort of squeeze your shoulder blades a little bit back and try and activate through your delts itself. Sometimes you can even use devices such as this to help you with your day-to-day activities, especially if you have quite an acute situation of shoulder pain. This can be quite useful for someone who's potentially even got a rotator cuff rehab or repair, or even in the mid stage of a frozen shoulder. So you don't necessarily have to feel that you're limited in your day-to-day activities.
So in the last sort of 30 minutes, we've covered the 5 strategies for successful shoulder rehab. We covered number 1, get a diagnosis from a health professional, get the arm moving early, address the muscle imbalances and deficiencies around the shoulder girdle, progressive gradual strengthening, and adjusting your daily activities and as well as occupational activities. Now, I've also promised to you that I would we would cover the 3 dangerous exercises you must avoid when you have a shoulder injury. So I know that a lot of you exercise for fitness to keep healthy, particularly going to the gym. So these three exercises are obviously the kind of exercise that a lot of people do to try and keep fit. So the first one is called upright rows. Okay, so essentially what it involves is holding on to a couple of dumbbells or a bar, and you lift them up in front of your body. Okay, the problem with this exercise is that your arm ends up in a very awkward position right at the top. When you get to the top, we call this position internal rotation. So that means your arm is twisted inwards. Now in this position, it's very common to get a sort of a type of shoulder injury called impingement. Okay, so a number of tendons in the bursa inside your shoulder get squashed in that internally rotated position. So if you do this over and over and over again, multiple repetitions, you're more likely to get these kind of problems. So that's why we advise against this type of exercise. And I would say not only when you have a shoulder injury, but just in general, it's definitely not my favorite exercise just because of the risk of a shoulder injury. So any exercise where you're holding a bar behind your neck, okay? So it might be squats, it might be sort of overhead presses with a bar, but anytime when you're kind of having to twist your arm backwards in that kind of way, it's not good. So we talked about internal rotation just in the previous slide. Now, this movement or this position is called external rotation. That's exactly the opposite. So you're twisting your arm back up and behind you. Okay. Also, this position here is it puts your shoulder joint in a very vulnerable position, because in this position, external rotation, you're most likely to dislocate your shoulder. Not only dislocate, but also being in that position can actually cause a lot of damage to a few structures around the shoulder area. Okay, so best to avoid it. And good old burpees. Okay, so a lot of people do CrossFit at the moment. That seems to be in a trend. So one of the, I guess, core exercises of CrossFit is burpees. But not only that, boot camps, they do a lot of burpees as well. Now, it's a great exercise to get fit. Okay, it definitely gets your heart pumping. All right, but if you have a shoulder injury, there's a lot of impacts, especially when you jump and you land on your arms. It transfers a lot of force through your arm and into your shoulder. And Sean talked about bursitis earlier, and so this kind of exercise can easily cause bursitis type injury. So I'm just going to play this video just to show you what a burpee looks like in case if you've never done it before. So it's a really cool way of you know, getting fit, because once you do say 20 of those, you certainly feel it. Like you definitely want to stop. But so if you want to get fit, that's good exercise. But if you have a shoulder injury, stay away from it, because it will probably aggravate your injury. So over the last 40 odd minutes, we've given you a lot of information about your shoulder injury, right? Hopefully you've learned something. Now, unfortunately, if you're not medically or you know, physiotherapy trained, you may find some of this information a little bit too much or a little bit confusing. If you'd like some help with clarifying what to do about fixing your shoulder injury, and maybe you want a solid plan of action, if you want to you know, have some certainty about getting rid of your shoulder injury and minimize the risk of complications and re-injury in the future, we'd like to invite you for a free shoulder examination performed by one of our fully qualified physiotherapists at either it's one of the 3 clinics that we run in East Auckland. So we have clinics in the Howick Recreation Centre, Pakuranga Leisure Centre, and the newest clinic is at the Howick RSA. So it's supposed to say 3 clinics. I just put 2 for some reason. So basically what it involves a 20-minute thorough examination of your shoulder injury, just to find out what is going on, so you know for sure what the story is and how to address it. If we need to, we can also send you for an X-ray or an ultrasound exam during this session. So if we need to order some sort of radiology examinations, we can do that at the same time. Look, so it's free. You got nothing to lose. There's no risk involved. You can to book your session, your free assessment. All you have to do is call us on this number on your screen. So it's 0800 00 2723, or alternatively, you can head down to this website, bodyfitphysio.co.nz/free shoulder exam. Okay, so any whatever method of contacting you prefer. Look, also, if you have any questions, it's now is a good time to ask. So you can there's actually a chat box function there, so you can type in your questions if you have any. Now you can also leave us, you can private message us on Facebook. If you're watching this as a Facebook Live, we will be happy to answer those questions as soon as we can. Okay. All right, look, so no questions, that's fine. So all the best for now. We'll be doing those presentations more often now. So next one will be about the back. So we're going to talk about the back injuries. Okay. Now, if you just want to, if you have any questions that you'd like to email us, you can email alex@bodyfitphysio.co.nz. Okay. All the best for now. Have a good night.